This is how eccentric left ventricular enlargement can lead to heart failure. The patient usually has some initial insult, like left ventricular dysfunction from ischemia, cardiomyopathy, could be a heart attack, and or some valvular dysfunction like AR or MR, so aortic regurg or mitral regurg. This causes left ventricular volume overload, which causes left ventricular stretch. And if you follow the Frank-Starling curve, this results in a high stroke volume. In the beginning, the patient is initially able to maintain their cardiac output, so the patient is asymptomatic. Then they have chronic volume overload. That high volume stays for a long time, and they end up with eccentric hypertrophy. The high stroke volume is maintained here at the expense of high wall stress. The patient still preserves their cardiac output, and they're still asymptomatic. Eventually, the wall stress becomes overwhelming, and the left ventricular enlargement gets so big that you get contractile dysfunction. At this point, the patient has decompensated heart failure, and this is when you start to see symptoms.